BeautyRx skincare products are the same products that have given my patients more beautiful. Sorry about that, folks. We'll be with you in a minute.
Let's try like this. Try again.
The reason that we're having the echo is so that you can hear my message 3 times. If the echo is better this time, then we'll get started one more time. How are we doing, Director?
No idea.
Okay, so we're going to have a brief interruption while we go back to the drawing board, and we'll be back with you shortly. Don't go away.
All sorts of things aren't working today.
Hmm?
There's no echo at this end.
Could it be because I have the other window open still?
What other window open?
I have 2 windows open.
Yeah, get rid of that 2 window thing. Oh no, you need that other window open.
Okay.
But don't have the 2 window like that. Don't do that.
No. I just have it like this. It says there's no.
It's not on mute. Try it again.
Well, Tans tells me that there's no echo on his end.
Ask other people.
Would any other viewers care to just comment in the chat box about whether they're getting an echo? Because if you're getting an echo, as much as you want to hear me, I don't think you want to hear it 3 times. Tell me how you think we're doing, Stu.
No echo. Okay.
Okay.
Alright, so just go for it.
So what I'm going to ask you to do is, if that echo does pick up again, please let us know. So we're going to skip the rest of the introduction, go right to the questions. So the first question is from Jeremy, and Jeremy asks, how exactly does Accutane work? Does it destroy oil glands or shrink them only temporarily? I'm about to do a second course of it and want my acne gone. I notice my skin is not as bad as before, so I'm wondering if the second course will cure me. Jeremy, Accutane actually stops the oil glands from making oil. And as you recall, if you don't have oil, you can't have acne. I know there are other things involved, like bacteria and clogs, but if there's no oil, there's no acne. So the Accutane doesn't destroy the oil glands, but it actually stops them from making oil while you're taking it. And usually, after your 4 or 5 month course of Accutane, the oil glands don't make enough oil to create acne after you've stopped the Accutane. If you're going into a second course, then obviously your oil glands reactivated more than they usually do. So by all means, take the second course. Usually it's a little bit longer and at a higher dose, but in the 10 to 15% of people in whom Accutane doesn't cure acne the first time around, 90% of them in their second course are cured of their acne. Hi, Dr. Schultz. This is from Misha, New York City. I'm a huge fan of Derm TV and also of your BeautyRx skincare line, which I've been using for 3 months. I recommend it to everyone whenever I get the chance. My question is, thank you. My question is in regards to dark under eye circles. I'm 25 years old and of Indian descent, and whether the cause could be pigmentation or heredity. However, it does not look like pigmentation, nor does anyone in my family have dark circles. What else could it be? And is there a permanent cure that doesn't involve using concealer every day? Actually, dark under eye circles have 7 different causes, which is why there's no one cream or topical product that makes it go away, and that's why there's no BeautyRx skincare product for under eye dark circles, because no one product can address all 7 of those issues. Some of them involve shadows just from light, because when people see us, usually we're vertical, whether we're sitting or standing, and most of the light in our environment comes from above, so we get shadows from fine lines and wrinkles under the eye, and also sometimes from a little puff over here. Also, there can be brown discoloration on the surface of the skin or halfway under the skin. And third, and perhaps of most importance, is that many people have hues of reds and blues and purples from enlarged blood vessels here. So no wonder no one product is going to help. And the reason that it's best to see a dermatologist to figure this out is because by identifying which of those problems are causing your under eye circles, then you can address them. If it's brown, you can bleach the brown. If it's shadows, you can fix the bulges or the wrinkles that are causing the shadows. And if it's enlarged blood vessels, laser treatment can destroy those blood vessels. So this is a situation where, without getting a professional opinion, it's going to be very hard for you to find a single product that's going to be able to help your under eye dark circles. And thank you so much for your very kind words. This is a comment from Stacy. I recently purchased your daily exfoliating therapy serum, which by the way is 8% glycolic acid, but have not started to use it. Every morning I use SkinCeuticals vitamin CE ferulic, which is 15% pure L-ascorbic acid, and once a week at night their retinol 0.5%. Every day I use Proactive Line, 2.5% benzoyl peroxide, and some skincare from Old Henschrichken brand with alpha hydroxy acids in them. Don't know the percent. Sunscreen every day with a big smile. My questions are, is it safe to use the daily exfoliating therapy serum with the products I'm currently using? And where in my routine order would I use the serum? Well, in regard to the first question, the daily exfoliating therapy serum is a terrific exfoliant. As I mentioned, it's 8% glycolic acid. But if you're also using retinol 0.5%, that's probably not going to cause much exfoliation, and certainly there's no interaction with the SkinCeuticals antioxidants that you're using. So there's no problem in using these products together. And again, there's no problem in using different products from different skincare lines. You don't have to be using all BeautyRx skincare products for your program to give you the skin that you want. I recommend using exfoliants at bedtime. So after using your cleanser and toner, I would recommend putting on the daily exfoliating therapy serum, which is a very light, thin serum. And remember, when you're layering products, you go from the lightest product to the heaviest product. And the SkinCeuticals product you mentioned is going to be a little bit heavier than my daily exfoliating therapy serum. And I believe antioxidants, like the product you're using, should also be used at bedtime, so you would use it after the daily exfoliating therapy serum. Just one more point. When you're using multiple products from BeautyRx Skincare, in order to avoid the confusion of when do I put which product on or in which order do I put them on, every BeautyRx skincare product has an RX number. And if you're using multiple products, just apply the products from the lowest RX number to the highest RX number, and you'll always be putting them on in the proper order. There was also so that really addresses both whether you can use both products at the same time as well as what order to use them in. And again, thanks a lot for your very kind comments. This is a comment from Michelle. And by the way, this is BeautyRx Live, and I didn't get a chance to mention that if you want to ask a question, go to BeautyRx Live BeautyRx.com and just use the chat box. If you're not on the BeautyRx website, if you're a YouTube viewer or anywhere else, just go to BeautyRxLive.com and use the chat box. Michelle says, "Hi doctor, thank you for the show and your products, I love them. What works for dark circles that are blue in color?" Well, if they're blue in color, that's coming from blue veins. And topical products are very difficult to wipe out blue. But if you were to use a foundation that has a complementary color, such as red or orange tint in it, that would help balance the blue. But sometimes it's very difficult to take blue out. There are laser procedures that will remove those blue veins, and that would be the most effective way. But in terms of topical products, I'm afraid you're going to have to use a concealer with a tint because, again, unfortunately, even in the year 2012, there are no topical products that can actually make enlarged blood vessels disappear or go away or even become less conspicuous without actually just concealing them. We have a comment from Jeremy. One other thing, do the fractional lasers get rid of redness, scars, and pigmentation problems? Actually, the fractional lasers are best at getting rid of scars. They don't work for redness, and recently it's been demonstrated that some of the fractional lasers actually can get rid of tattoos. They probably won't get rid of pigmentation problems, but the fractional lasers are going to be best at getting rid of scars. Michelle asks, does the Silken at Home laser really work to remove body hair permanently? And Michelle, the answer is yes, it does, but it's only going to be effective for a small percentage of your hair. So all of the at-home devices at this point, which are FDA approved, have been FDA approved because they are safe, and the FDA is very concerned with you not being hurt by these at-home devices. But when they're FDA approved, it doesn't mean that they are terribly, terribly effective. So you may get a 5 to 10 or maybe even a 15% permanent reduction in hair with that at-home device, but we just have to limit your expectations so that you're not disappointed with the results. These products work, but they don't work as well as professional strength lasers and devices. And just to go back to Stacy's questions for 1 minute, she had a third question and mentions that on the last live broadcast that I mentioned that certain retinols or retin-A cause broken capillaries. Which ones should I avoid? I've used Differin and Tactuo in the past, but want to incorporate some of the prescription retin-A in my regimen for anti-aging. Unfortunately, Stacy, the issue of potential broken capillaries applies to all the retinoids. So it doesn't matter whether you're using retinol, which is converted to retin-A, or Differin, or Tazorac, or even Renova, which can be used for people with more mature skin. They all have the same potential to cause mild but conspicuous breaking of capillaries, which again is why, as an exfoliant, I prefer glycolic acid-based products, which I think is the gold standard in chemical exfoliants. And of course, all of the BeautyRx skincare exfoliants are glycolic-based. Comment from a guest. Hello, guest. Welcome. Is a BHA exfoliant just as effective as glycolic exfoliants? Actually, the most common and most popular BHA, which means beta-hydroxy acid exfoliant, is salicylic acid. The issue with salicylic acid is that most products have between 1/2 and 2%, and 2% just isn't strong enough or effective enough to get sustained and consistent exfoliation. At greater than 2%, it requires a prescription. So the over-the-counter products are going to be under 2%. Again, going back to AHAs, one of the reasons that I prefer glycolic is because glycolic is available from 1% up to 15 and even 20%. So there's a wide spectrum of strengths that can be used according to what your actual needs are. And the fact is that 2% salicylic acid just isn't strong enough of an exfoliant to use for facial rejuvenation on a consistent basis. It is often helpful for a small amount of exfoliation for acne problems, but not really for facial rejuvenation. Nicholas asks, what are your experiences in observing severe adverse effects of using Accutane amongst your patients? People are writing some very nasty stories. Nicholas, it's a very important question. I believe that Accutane is one of the miracle drugs of the 20th century. I've literally seen it change people's lives, affect people who were involuting either socially or professionally, and really very, very much off their potential and their mark because there was such a severe emotional impact by their acne. I've seen Accutane turn those lives around. I believe that acne causes depression, Accutane cures acne, and therefore helps relieve depression. There are some bad reports, or I should say there are some reports of bad side effects from Accutane, including depression, inflammatory bowel disease, and of course, in women, a very real problem is teratogenicity, which means that if a woman who is pregnant takes Accutane, she will have a deformed baby, and that's for sure. But proper usage of Accutane restricts Accutane from being used during pregnancy because you have to be regularly tested to ensure that you're not pregnant. And before you start to take Accutane, if you're a female, you have to explain that you are both religiously and morally capable of having an abortion, since you must abort if you become pregnant on Accutane, since Accutane ensures a deformed baby. But other than the teratogenicity, all of the allegations about inflammatory bowel disease, depression, and the other problems I find to be way overstated. I've been using Accutane in my patients since 1981. I probably used it in 1,000 patients. I've only had to stop it in 2 patients in that 30-year period, and one of the reasons was because a patient who was depressed before he started Accutane became more depressed on Accutane. He was taking multiple other medications from a psychiatrist for his depression, but because he became more depressed, and we don't know if it was from the Accutane, we stopped the Accutane. In the other patient, there was an elevation of one of the blood fats called triglyceride. But my experience with Accutane, when taken as prescribed and used under a doctor's supervision, has really been terrific, and it's really been a life changer for my patients. Again, this is BeautyRx Live. We are live streaming video. If you have a question, please go to the chat box at BeautyRxLive.com. This is a question from Regina. I'm of Indian descent with dark brown skin. My question is, how does the sun make the skin on my forehead look lighter instead of darker when I go into the sun? Regina, in dark-skinned people, people of Italian descent, Indian descent, Asian, or Hispanic descent, those people are genetically much more susceptible to a condition called melasma or cloasma, also called the mask of pregnancy. And in this situation, pigment cells in certain places on your forehead and cheeks and even on your upper lip have been sensitized by your normal female hormones, either your normal hormones, hormones of pregnancy, or birth control pills, so that when the sun hits those cells, they turn dark. They produce too much pigment. The melanocytes go into overdrive. And I think what you're really describing is that when you go in the sun, most of the area on your forehead gets darker, but there's a certain area on your forehead that's not affected by the melasma. So when the area around it gets darker and the area that's not affected by the melasma doesn't darken, it's made to look lighter. And this is a common complaint that we see from people who are dark-skinned who have melasma, where they don't understand that it's really their skin is getting darker except in certain areas, and that most likely explains the lighter areas after you go into the sun. We have a comment from Michelle. Thanks again. Who makes a good vitamin C for oily skin under $30? Michelle, I wish I had an answer for you. One of the problems is that a lot of the antioxidants, which are vitamin C based, and again, vitamin C based antioxidants I think are the best. Most of these products are not cheap, and I know of no products under $30 which are vitamin C based. The reason for that is because the best vitamin C products don't just have vitamin C in it. They don't just have ascorbic acid. Actually, they have esters of ascorbic acid, such as methylsilanol ascorbate or tetrahexyldecyl ascorbate. And the advantage of the esters is that the esters are lipid soluble, so they better penetrate the skin, because the skin is a lipid membrane, not a water-based membrane. But if you're going to use those products in antioxidants, they're more expensive to make. So rather than answering where you can find a vitamin C-based antioxidant for under $30, let me make a suggestion. I think another terrific topical antioxidant is caffeine. And caffeine is available in many different over-the-counter products made by Garnier. Garnier has put caffeine in a lot of their sunscreens and moisturizers. A lot of these products, I believe, are under $20 and some of them under $15, and that would be my best suggestion for a less expensive, effective topical antioxidant. This is a question from Tans again, thank you. I work in a small office with one window. Unfortunately, I don't have control over whether or not the blind is closed. During the winter, do I need to apply my sunscreen every 3 to 4 hours while sitting in the office while the blind is open? Tans, that's a great question. And the answer, believe it or not, is yes, you do. Because the window glass stops most of the UVB light, but it has no effect on the UVA light. And UVA is the type of damaging energy from the sun, which causes premature aging of the skin, as well as causing skin cancer. And most of that goes right through the window. So if you are sitting in direct exposure to sunlight, then you actually do need a sunscreen during the winter. Most sunscreens today have UVA protection in them, but just make sure your sunscreen is marked, regardless of the SPF value. Make sure it's marked either with UVA protection or broad spectrum protection. And one other thing, believe it or not, if you're not sitting right in front of the window, but you're actually sitting someplace else where you're being hit with sunlight, which is being reflected off of mirrors in the room, the mirrors reflect most of the UVA, so you still need your sunscreen. We have a comment from Michelle, and Michelle is asking, what's a good skin lightener without hydroquinone? There are a lot of topical skincare products that use as their bleach either kojic acid or azelaic acid, but BeautyRx Skincare's skin complexion lightener actually is using just peptides without hydroquinone. I have a proprietary ingredient called pentabrite, and that pentabrite includes arbutin and 4 other peptides, all combined together without hydroquinone, which works just as well as hydroquinone-containing bleaches. But again, there are many other products available with kojic acid as well as with azelaic acid. This is from Sasha, who's read some disturbing stuff recently about titanium dioxide being a photocatalyst and actually not good for you. Also about nanoparticles and mineral sunblocks penetrating the skin. Can you clarify? Yes, I'd be happy to. Let's answer the second part first, which has to do with micronization, which is turning those sunscreen particles into very tiny particles and even into nanoparticles. The reality is that when the tests have been done, they have demonstrated that while these particles can get into the epidermis, they don't get into your bloodstream, and there is no meaningful recovery of the nano-sized particles of either zinc or titanium when good, well-controlled studies are done. In addition, in terms of titanium dioxide being a photocatalyst, the reality is that while in laboratory situations it can be a photocatalyst, in vivo, meaning inside the human body, we just don't seem to have problems with that. So I still endorse physical blockers, whether they contain titanium dioxide or zinc oxide, as do 2 of the BeautyRx skincare sunscreens, in particular the Maximum Solar Defense Sheer Cream SPF 50, which has titanium dioxide, and the Chem-Free Solar Defense SPF 30, which has both zinc oxide and titanium dioxide. Please use sunscreen and use it every day. a sunscreen with an SPF of between 15 and 30 that's marked and labeled with UVA or broad spectrum protection. Jeremy asks, which vitamins are best for facial skincare? Jeremy, it really depends on what you want to accomplish. So I believe that vitamins A, C, and E are really great antioxidants. And in particular, vitamin C, which I mentioned before, and I mentioned the 2 esters of vitamin C. Vitamin E is terrific for the skin also, and these are the ones that I would have you look for in skincare products used for the face. In BeautyRx skincare products, I use a proprietary antioxidant called Tri-Antiox, which includes those, as well as caffeine that I mentioned before. And in my protective vitamin C rescue serum, we have a very high concentration of methylsilanol ascorbate, which again is a vitamin C derivative as an antioxidant, and I think that's one of the best as an antioxidant. I'm just scanning through the questions to be able to find questions from everybody who's joining us today. Misha in New York says, would you recommend using a daily exfoliator in lotion form for the body? And the answer is absolutely yes. Again, I believe that exfoliation is the single most important therapeutic thing you can do for your skin, whether it's facial skin or whether it's your body skin. Of course, the most important preventative thing you can do is sunscreen, but therapeutically it's exfoliation, and I recommend a 10 to 15% glycolic product in lotion form so it spreads easily to use on your body every day. Christine asks, does everyone need to use a moisturizer? Christine, what a great question. But then again, all of these questions are great. And don't forget, so many of the Derm TV episodes are based on questions from viewers. So please keep writing in questions, whether it's on BeautyRx or Derm TV. But Christine, in terms of moisturizers, does everybody need to use a moisturizer? Well, there are 2 reasons you need to use a moisturizer. First, if you have dry skin. And dry skin we recognize as either looking flaky or feeling tight. And on the face, that usually happens on the cheeks rather than in the T-zone. So if you don't have either of those issues of either feeling tight or appearing flaky on your cheeks, then you wouldn't need to use a moisturizer for that. But the other very important role for a moisturizer is that it helps by hydrating the skin and causing a small amount of swelling, it helps to take away temporarily fine lines and wrinkles. So that's particularly relevant under the eyes or in the crow's feet area. But again, if your skin isn't dry and you don't have an issue with fine lines and wrinkles, then there's just no reason why you need to use a moisturizer. I don't know if this is from Annie. I don't know if this is the right place to ask, but do you ship products to India? Annie, yes, BeautyRx ships products all over the world, and one of the reasons that we do BeautyRx Live is so that people who don't have access to me in my office, since BeautyRx skincare products are now available to everybody everywhere, so that people like you can have access to me, asking me questions about how to use the products or any questions about the products. But yes, the products are shipped to India, and they're shipped to India on a daily basis. Sarah says, I started using at-home peels, and it resulted in brown spots on my cheeks. Is my skin permanently damaged, or is there anything I can do to clear those dark spots? I've tried bleaching creams, but it doesn't work. Will any of your products work? Sarah, thank you. It really depends on what those brown spots on your cheek are made of. If they are really brown and not red, and sometimes that's a little confusing, but if they're really brown, if it came from the at-home peel, it's because the peel was too strong and damaged the skin, and damaged skin darkens. So the way we treat damaged darkened skin, which is also called post-inflammatory hyperpigmentation, is by first of all using a strict chem-free sunscreen every day, because any sun exposure you get can darken your skin additionally much faster than our bleachers can lighten them. So I recommend using a chem-free sunscreen every morning. regardless of whether you're going out, whether you're going to work, whether you're going to be at leisure. And then you need to use an exfoliant daily and a bleach. The exfoliant is to take off the dead cells that have accumulated too many layers of cells that have too much pigment that causes the brown, and the bleach is to stop the new cells from making more brown, because the area that you're seeing as brown now is actually making too much pigment in response to the injury. We need to turn off that production of pigment, and you've accumulated too much, and that's what the daily exfoliant is for. Well, here we are saying that you did an at-home peel, which is obviously an exfoliation that caused this problem. So it may be that you have very sensitive skin, and therefore, in using either a bleach or an exfoliant, reintroducing it, you really need to test it before you start to use it on your whole face. And the way you test it is by putting a small amount in front of your ear on a 2 or 3 centimeter area or a quarter-sized area for 2 or 3 nights to make sure it doesn't bother your skin doesn't get red or itchy. And if you don't have a problem with that, you can then go on and use it on the rest of your face. But be very careful, because you've already demonstrated that you have very sensitive skin from the fact that that at-home peel caused the damage that it did. We have a comment from Eric in Indonesia. I heard people with oily skin will age more slowly. I've taken 1 course of Accutane and all of my acne is now completely gone. But will I now age more quickly since Accutane made me less oily? Eric, that's, again, another great question, and a question we get from a lot of people who've taken Accutane. The real issue with premature aging of your skin comes not from how much oil you have or don't have, but it really has to do with sun exposure. The only way you can prematurely age your skin is by exposing it to unprotected sun exposure. So if you're using an effective sunscreen on a daily basis, now that you've finished your Accutane, if you're using a sunscreen with an SPF of between 15 and 30 with UVA protection, and applying it every 3 to 4 hours and immediately after swimming and sweating, that is the most important thing you can do to prevent premature aging of your skin. The fact that you've taken Accutane and you've slowed up your oil glands is not going to really have any material effect on the rate of aging of your skin, I'm very happy to tell you. Barbara says, is it true that oily skin will produce even more oil if you don't apply a moisturizer? The theory is that the skin is reacting to a lack of moisture or oil, and oil production goes into overdrive to compensate. Barbara, this is an old wives' tale that I've heard from many people and seen in many places. The answer is no, it's not true. Let me remind everybody that oil glands make oil and water glands make water. So if you're not applying a moisturizer, that means that you're not restoring any extra water to your skin. It has nothing to do with the oil content of your skin. Actually, if you're very oily, that may help hold some water in as the oil spreads on your skin and lubricates your skin and coats, and that's one of the functions of your skin oil. But not applying moisturizer or having dry skin does not cause you to make extra oil. In fact, the only thing that causes stimulation of oil production are male sex hormones, and even women have a very low concentration of male sex hormones, but that is what causes your oil glands to make more oil, which is why when you're stressed, your skin gets oilier, because in response to putting out cortisone to deal with the stress in your body, your adrenal gland also puts out a little male hormone that turns on the oil glands, even in women, and then you get oilier. Sylvia asks if dimethicone in face creams is able to clog pores. Actually, dimethicone is a fairly volatile chemical, meaning that it evaporates. So the dimethicone is often used as to help spread the chemicals or the different components of the skincare product, and then it will often evaporate. Dimethicone is not going to clog your pores. Misha in New York says, what is the reason for dandruff on the head and how can it be cured? Well, this actually goes back to what we were just discussing about oil production. Dandruff is actually dead skin that's falling off in large flakes. Normally, when your skin is shed, it's shed in very small particles, individual cells, and they're invisible. But if it comes off in large plates where the cells haven't had a chance to fall apart from each other, then it's a larger amount of dead skin, and that's visible as a flake of dandruff. Think of a brick wall. If the bricks come off one at a time, you can just see small individual bricks which are hard to see. But if a whole wall of 1,000 bricks falls off, that's a big deal. So your scales or flakes that you're seeing is comparable to 1,000 bricks or 1,000 skin cells. And the reason they fall off in those large sheets is because they've come off too early. They haven't had a chance to fall apart from each other. Because when they do fall apart from each other and come off as individual cells, you can't see them. Well, excess oil production in the skin causes inflammation of the skin. Inflamed skin becomes a little red and is then shed prematurely. So by falling off too early, it's coming off in these large flakes. So dandruff is actually caused by excess oil production, and as we mentioned before, excess oil production is often under the control of male hormone. Well, sometimes it's difficult to manipulate the amount of male hormone you have internally because we don't want to manipulate it because there would be a lot of other side effects. So this is a situation, dandruff, where rather than treating the cause of the problem, we treat the symptom, we treat the flakes, we treat the scaling. And so most of the dandruff shampoos have chemicals that slow down the shedding and slow down the inflammation so the cells don't come off on those large flakes that you can actually see. Marga asks whether salicylic acid needs glycolic acid in order to be effective for getting rid of blackheads. Marga, both salicylic and glycolic by themselves can be very helpful in getting rid of blackheads. I think glycolic works a little better, but you don't need to have them together. However, if you do put them together, you get a synergy. And by a synergy, I mean they help each other. And in helping each other, the salicylic makes the glycolic work better, the glycolic makes the salicylic work better, and that's why both of those are in the BeautyRx proprietary ingredient tetrafoliant, which is a proprietary exfoliant compound, because we capitalize on and benefit from the synergy between the alpha-hydroxy acid and the beta-hydroxy acid. So together they work better, but individually they both can be effective at treating blackheads. Valerie says, in your DermT videos, you recommend a vitamin C serum as a daily antioxidant. I looked into this and found out that vitamin C oxidizes very quickly. As a result, is it possible that it's useless by the time I buy it? How do you recommend one should buy a serum and where? Well, Valerie, you're correct. A lot of forms of vitamin C are not stable, and they do oxidize quickly, and that's really why we use them. We use them because they are antioxidants. So the problem with regular ascorbic acid is just what you've described. Instability, particularly when it's exposed to light. So number one, any antioxidant you buy that's vitamin C based should be in an opaque bottle. It shouldn't be in a clear bottle because you don't want ultraviolet light to be hitting the antioxidant in the bottle before you use it. Number two, the esters that I mentioned before, tetrahexadecyl ascorbate and methylsilyl ascorbate, are much more stable forms than most other forms of just plain ascorbic acid. So I would recommend, obviously, the BeautyRx Skincare Protective Vitamin C Serum, which has these chemicals. But if you want a stable product, make sure it's not just ascorbic acid and that it's in an opaque container or bottle. Apparently vitamin C is in the news because Juan says, is vitamin C serum in powder form effective? And unfortunately, Juan, when it's in powder form, again, we're talking about ascorbic acid and the things I mentioned before about the instability of plain ascorbic acid. This is from Sarah's Skin. I have really dry skin on my face and legs. My legs always itch terribly, and I hate slathering on lotion all the time. Even my nails are dry and peely. What am I missing here? I tried to drink more water to no avail. Sarah, drinking water isn't going to help dry skin, and I think we've pretty much established that in a lot of different situations. For dry skin, you need to either add moisture back or make sure you're removing less moisture. So to add moisture back, well, you're back to using lotions. And when your skin is very dry, you're going to have to use a moisturizing lotion. But more importantly, perhaps, is removing less moisture and oil from your skin. So if you have very dry skin, you want to use soap on that part of your skin very infrequently, because the soap removes the protective oils you have that help hold in the little moisture that your skin has. So soap can be very drying. In addition, after your bath or shower, you want to put on your moisturizing lotion right away to help lock in whatever moisture your skin has absorbed in the shower. And hot water in the bath or shower makes you lose more of your natural moisture, so make sure the water is warm but not hot. But when we discuss winter skin care, because in dry, colder weather we tend to have drier skin, or our skin becomes more dry, the measures that we recommend are both removing less oil with less soap, as well as using moisturizers effectively. But I'm afraid that just doing one or the other may not be sufficient to stop your dry, itchy skin. Again, this is BeautyRx Live. If you'd like to ask a question, you can go to BeautyRxLive.com and use the chat box. We are live streaming video, and we come to you the third Wednesday of every month to answer questions for anybody about BeautyRx skincare products, whether you use them or whether you're thinking about using them, or any skincare related questions. Kimberly says, at what age do acne pimples stop? I'm hearing different ages, like 21, but I've seen people who have acne and are 27 years old. Kimberly, 27 isn't that old. Do you know if acne stops at a certain age, or do you keep breaking out? Or is it? I know it's different for every person. Is there an average age? Kimberly, I wish there were an average age, but I'm going to tell you something. First of all, most people's acne does stop at some point in their 20s or in their early 30s as an average. But on the other hand, in the past 2 decades, we've seen an interesting phenomenon where acne keeps going in women in their 40s and sometimes even in their 50s, to the point where pimples collide with wrinkles, which is very unfair. But the bottom line here is there are many, many effective treatments for acne today that can stop your acne without it having to continue. So while I can't tell you at what age it's going to stop, and 27 may not be that age, I can assure you that if you treat your acne, you won't have much of a problem getting it under control with today's ingredients, cleansers, toners. We have some terrific products for acne and BeautyRx, but there are a lot of other very effective acne products made by many different skincare lines. Let's try to handle one more question before we stop for today. Dina asks if she can use lemon juice on her face at night. Lemon juice is generally used as a weak bleach, so if you're dealing with brown spots or darkening, lemon juice is a weak but sometimes helpful bleach. Other than that, I'm not sure there is much of a role for it on your skin, but again, because lemon juice is actually an acid, make sure you test it in a small area in front of your ear before you use it on your entire face, because we want to make sure that you just don't, so that you don't have any problems or have a reaction to it. If you have questions that you've submitted that we haven't been able to get to today on BeautyRx Live, if you would please submit those questions to Derm TV. I'll try to get to as many of them as I can in this viewer question week, as well as responding to some, or as often is the case from your really great questions, they become the subject of a Derm TV episode. So please keep watching, please keep asking, and I'll see you again next month. Tomorrow's episode on Derm TV answers questions from our viewers from DermTV.com, and have a great one. This is Dr. Neil Schultz, and thank you for joining us today.